Hey guys. Get some people on here first. Where is all my people? I'd like to know, I'd like to see them. Hey, who's on? Say hello. I'm gonna wait for a couple more people. Hi, honey. Oh, what's the matter? Why's that face? My title or something going on in life? Uh-oh, what happened? Hi, whoever else is on, say hello. I'm gonna get into it, I promise. It wasn't a, what do you call, I can't remember what it's called. Ah, hello, service dog. Oh. Clickbait, that's what it is. Well, the best thing to do with that, in all honesty, is start to slowly have her... Oh! Hello, Lulu. Why'd you change your name? Anyway, the best thing with that is to have her go around dogs that are definitely not reactive, and that will help. Third person, come on, I promise, or tell me who you are down below. I promise I am not, it wasn't clickbait. I just want to wait for at least 5 minutes for other people to come on. I don't get a lot, but okay, that's alright. It's a cool name, I like it. People will stop calling you by that name. And no one will know Lulu. So there you go. Voila. I'm having issues. I ended up in the ER last night, guys. I was in semi-bad shape last night. Roxy. I gotta come up with a different name because her dog's name is Roxy. Let's see. So we call you Lulu. Alright, Roxy, put some nicknames you like down below, or in there, and let's see. Okay, they can't train together. And your trainer should know that. They cannot train together. Ruru! Okay, Lulu and Ruru! I like it. Alright, Ruru. Now, if that third person on there will just comment, and we'll know who it is. Yes, just to let you guys know, I am going to be getting into this. I at least want to wait for the 5 minutes. And this is something very important, even for you younger ones. This is very, very important. Extremely important. I may miss some of your comments, so I just want to get through this quickly. I've been not accused, but told that, oh, okay, but Cookie and Roxy cannot be training together because that training session won't go well. You got two dogs that are reactive to other dogs that they feel that might bite them. What you need to do is find a dog like Ellie. Yeah, no. Not two dogs that have the same fear, because, I mean, you're putting them together and they have the same fear. They're going to feed off of each other, and that is going to put more stress on Roxy and Cookie. So they're not going to be able to advance and get better and learn, you know? So you need a dog that will sit off to the side and have Roxy go up to him or her. You know, a dog that's not reactive. No, it's okay. I mean, usually it's alright if they are, you know. But anyway, you need a dog that is not dog reactive. And if they're sitting off to the side like Ellie does and just sits there, you let Roxy make the first move, you know, and just, but not in a close proximity, you know, like one end of the room and the other end of the room, and just let her go around and see that this dog is not reacting to her, is not trying to charge her, not trying to go after her. Yeah, but I think if your dog is reactive to other dogs because she's a fear of getting bit, then she has to be trained by a dog, by the trainer, by herself, with one other dog that is not reactive. Not yet, not yet. I have hope for Roxy. She's come a long way. You know, it's just, see, I'm having this situation because we're dealing with the same situation at my daughter's college. There's a guide dog, a seeing eye dog, that is very reactive to dogs, and I'm having a hard time having that dog be there because it almost attacked Ellie. It was trying to attack her. But you don't have to wash them. You just, there are ways to train them. You could even look it up and train them yourself too. Don't give up. Give it a couple more months. Have your parents give it a couple more months and be like, you know, you need a trainer that will train her. Seriously, please listen to me on this. You have a reactive dog. Because of a fear. Putting her in a room with a bunch of dogs is causing her stress. And that stress is not helping. So if she's in a place where there's only one other dog, and that dog is not that dog's like Ellie. I don't know if you've seen how Ellie is, but Ellie is very good. Yes, I think you commented on my video yesterday of her at the restaurant. Ellie is very good. She's very well behaved. She's very calm. She doesn't react to other dogs in any way, unless they come close to her, and then she'll sniff them, but that's a natural reaction. She doesn't try to growl at them. She doesn't try to bite them. If they're acting hyper, she backs away and calms down and just lets them be the way they are, you know. So that's the type of dog you need to train Roxy with. Alright, it's been past 5 minutes and I need to get into this. So forgive me if I don't answer any questions, okay? Yes, okay, but obviously she can't be trained with many dogs, only one dog. And you need to get her socialized with Cookie outside of training. Alright, so what was my title? Anybody know? I said ovarian cancer and the diagnosis. All right, ovarian cancer is one of the top 5 leading cancers of females that death caused by cancer causing deaths. You guys know what I mean. Well, if you socialize him with Roxy and only Roxy, it might make a difference. But it has to be a continuous thing. It can't be like once every 2 months or anything like that. Good. Alright. So, I'm doing this live because I've been very stressed, and the doctors are acting like it's in my head, and I know deep down that my cancer is spreading, and no, I don't want to admit it, but you know, it's very stressful. Alright. What is ovarian cancer? We're going to go in. What is ovarian cancer and what are the symptoms? This should probably take maybe 5-10 minutes to read. And I'll put in the description afterwards about what time that the ovarian cancer talk starts. Alright. I'm reading from a book because people are saying, oh, don't go on the internet, don't go on the internet. No, this is research that has been done by doctors, oncologists, and everything, researchers, that they put into information. And there's not a lot of information on ovarian cancer. And it is the 5th deadliest cancers in women. There we go. That's what I wanted to say. Okay. Why don't I just read this and shut up? This may not be interesting to you, younger ones, Lulu, Ruru, but I'll get into that in a little bit. What you just asked, Lulu. Ovarian cancer is one of the deadliest cancers among women. About 1 in 55 women is diagnosed with ovarian cancer in her lifetime. The National Cancer Institute estimates that about 22,000 new cases of ovarian cancer will be diagnosed in the United States yearly, and about 16,000 women will die every year of ovarian cancer. It's okay. You can get off if you want to. I just need to go through this because it's something that I feel needs to be put out there. Okay? So if you feel that it's going to get intense, there's a couple of intense things in here, so go ahead and click off. It's okay. Okay? I won't not like you because of it, okay? However, that being said, it's something that you need to think about as you're getting older, okay? No, this is just information for people that don't know. Oh, I'm sorry. Alright, let me get back to this. I'm sorry. Unfortunately, it's okay. If you need to go, you can go, okay? There is no simple test available to screen women for ovarian cancer. Most people incorrectly think that Pap smear checks for ovarian cancer, but it does not. Pap smears only test for cervical cancer. Education about ovarian cancer is one way to try and help people to know when and why they should see a doctor and talk about ovarian cancer. Not detecting ovarian cancer early makes the possibility of a cure more difficult. This is because the ovarian cancer has spread beyond the ovary when it is diagnosed at later stages. Finding the disease at earlier stages is less common. This is very important information. People may not like it, but it is very important. Because hello. Alright. The disease at earlier stages is less common because many women do not have symptoms when they first get the disease. Ruru, look what you wrote. See, there's ways to get laughter in here. Alright, additionally, women who do have symptoms often think they are due to a less serious cause. This is because the symptoms of ovarian cancer are often common symptoms that affect many women without cancer. These symptoms may include bloating, nausea, and the feeling of being tired and worn out. What have I been complaining about? You're not dead. Because these symptoms are so common, women and doctors often do not think about the possibility of ovarian cancer until the disease has advanced. For example, if a woman has bloating, she's more likely to blame gas and ovarian cancer. Oh, yeah, that was funny. I'm like, look what you put. Guys, if you can't see the comments after the video and you're like wondering why we're laughing, she accidentally put one word. She meant to put shots, but she didn't put shots. Anyway, because the symptoms are so common, women doctors okay. For example, if a woman is bloating, she is more likely to blame it on gas than ovarian cancer. Women and their doctors, however, need to consider the possibility of ovarian cancer in all women with new symptoms that could be signs of ovarian cancer. Yeah, I got it. This is especially true if the symptoms occur almost every day and do not go away for after several weeks. I've been complaining about this how long now? Lulu, of all people, will know. Out of you two. Asking a doctor to discuss ovarian cancer is every woman's right. Women and their family members should know that they can ask the doctor any questions and that their doctor will take them seriously. Bull shenanigans. Ovarian cancer is a disease. Okay, know the symptoms. Okay, these symptoms represent many illnesses. If they persist more than 2 to 3 weeks, you definitely need to talk to the doctor. Don't be afraid to bring up ovarian cancer or cervical cancer or uterine cancer. Don't be afraid to bring it up. Just say, hey, I don't think it is, but could there be a possibility? Stuff like that. But know the symptoms. Okay. Yes, honey. I'll go into my story after I get done with this. Well, a lot of people don't know that. No being dog, that's not nice. Ovarian cancer is a disease that is not well understood by most women. Yes, and it is one of the least likely diseases to be found in early stages, by the way. Many women and their families do not know how much do not know much about it, even though ovarian cancer is the 5th most common cancer in women. Don't be sorry. Fine. Recent studies in medical journals show that most women feel symptoms for several months before they are diagnosed with ovarian cancer. However, the symptoms are often mistaken for other common ailments, such as indigestion and urinary tract infection. Not taking symptoms seriously or not seeking a doctor can lead to a delay in diagnosis of ovarian cancer. In fact, the American Red Cross says that about 20%, which means 1 out of 5 cases of ovarian cancers, are found early. That's a poor percentage. Detecting the disease early usually means a woman will have a better chance of recovery. Being aware of the possible symptoms of ovarian cancer may help women find the disease early. In June 2007, the Gynecologic Cancer Foundation, the Society of Gynecologic Oncologists, and the American Cancer Society released the first national consensus statement of symptoms of ovarian cancer. The statement suggested the symptoms most often reported by women with ovarian cancer are bloating, pelvic or abdominal pain, that's 2, difficulty eating, feeling full quickly, hold on, sorry. However, many symptoms may be different for different women. Other women have also reported changes in bowel function, which is diarrhea or constipation, which I have, and I have 3 of the other things: nausea, unexplained weight loss, fatigue and indigestion, back pain, pain with intercourse, and menstrual irregularities. Women who have had symptoms almost daily for more than a few weeks should see their doctor for an evaluation and discuss the possibility of ovarian cancer. Symptoms can occur in women at any age. It is very important that women tell the doctor as much about the symptoms as possible. It may even be helpful to write them down, or write down some of the following details for the doctor. When the symptoms started, how long the symptoms have lasted, what the symptoms feel like, if there were any lifestyle changes, like change in diet, sleep pattern, exercise routine, etc. That happened when the symptoms began. If the symptoms are getting worse, better, or staying the same. What makes the symptoms worse? What makes the symptoms better? It's it can be hereditary. It's a disease that just wants to attack. It's just like any other cancer. It's unexplainable. Like, your diet and stuff can be not a cause of it, but can aid in it and stuff. It's hard to tell what causes it. It's just like any cancer. What causes it? It's a chemical imbalance of the cells or something like that. Women should also bring their doctor a list of all medications prescribed over the counter and vitamin or mineral supplements that they are currently taking. The list should include how much they take, how often, how they take it, and if there are any special instructions on taking the medication. If women do not want to write this information down, they should bring the actual medication with them to the doctor. That's what I do. I bring my medication to the doctor all the time. Wait, what? No, no. What? Absolutely not. Oh my God. Let me clear this up, okay? You cannot get ovarian cancer. You can't get cancer from any cancer from sexual intercourse. It's not a sexually transmitted disease. So your teacher was false in that category. Herpes you can get from intercourse. Chlamydia, sexually transmitted diseases you can get from sexual intercourse. Cancer, any type of cancer, is not a sexually transmitted disease. Right. I can't believe your teacher told you that. Is that what she told all you girls? Like, for real? No. Absolutely not. That's false. That's false educating, actually. Oh, that ticked me off. I'm sorry. Unless she's telling you that to scare you guys out of having sex. And if that's the way that they're doing it, there's a problem with that. That is not okay. And if I was your mother, trust me, I'd be going up one side of that teacher and down the other. I am not afraid to go after a teacher for being wrong and teaching my child wrong information. Just ask my daughter's first grade teacher. Or was it her second? I think it was her first grade teacher. Girl, you want to learn about health? You come to me, I'll help you. Alright, giving the doctor as much information as possible may help him. Before I say this anymore. For those of you that are watching this after the fact and can't see the comments going on in the video, one of the people, one of my family, I call you guys family, one of the family members just said that her teacher told her that ovarian cancer is caused by sexual intercourse. She goes, unless she said cervical cancer. Regardless, it's not caused by sexual intercourse. That's false, and I think teachers should definitely not be talking like that to students because it scares the shit out of them for life. Ugh, irritation. Sorry, honey. Alright, back to it. Giving the doctor as much information as possible may help him or her, help them, there we go, figure out if the symptoms could be related to ovarian cancer or if there is something else causing the symptoms. It is important to act quickly to find and treat the cause for new symptoms. If the diagnosis is ovarian cancer, the hope is that finding the disease early will lead to improved chances of a cure. Women should pay attention to any changes in their body. Women who feel that something with their body is just not right should see the doctor and talk about what their symptoms may be due to and may bring up the possibility of ovarian cancer. is at risk. This is the most important part. And I think that this is even has some misinformation because, yeah. Anyway, ovarian cancer is the 5th most common cancer in women. More than 22,000 women in the United States will develop ovarian cancer this year. And about 16,000 women with ovarian cancer will die this year. And that rate actually went up because it was 15,000 and now it's 16,000. Oh, I love you guys too. These numbers show that the disease, and these are cases that are found. They don't include the cases that when women don't have insurance to go to the doctor and get this stuff found out. Well, I'm trying not to. I got a daughter that I love more than anybody in the world, and I'm trying not to leave her. And that means I would try not to leave you guys either. Alright. These numbers show that this disease is very hard to diagnose when it can still be cured. Nice! Cool. That's awesome. The symptoms of ovarian cancer are often vague or get confused with less serious conditions. The pap smear is not, I repeat, not a test to find ovarian cancer. It is to find cervical cancer, not ovarian. Learning who is more likely to get ovarian cancer is one way to help women find the disease early. The sooner ovarian cancer is found, the better the chance of recovery. Some women at high risk, after consultation with their health care provider, may choose preventative strategies that can significantly reduce the risk of ovarian cancer. Cool. I'm reading my comments here, guys. The chance that the average woman will get ovarian cancer is low. During her lifetime, the chance is about 2%. This means 2 out of every 100 women will get ovarian cancer. Doctors cannot always explain why some women get ovarian cancer and others do not. However, we do know that ovarian cancer has been tied to certain risk factors. A risk factor is something that increases the chance that somebody will get the disease. Some risk factors are much stronger than others. What?
I mean, you're giving mushroom soup.
What? No, what one? What? Come here! The one what?
It's not in the fridge.
How many mushroom soups do I have in the...
There's one in the fridge.
Yeah, that's nasty. I saved it for you to see if you'd like it. It is way too garlicky for me. That's why I told Daddy to get the one without garlic.
I got the 20-something must-have one.
Go ahead. But, no, go ahead. I'll have the England clam chowder. But, can you also do dishes? Thanks.
I'm doing homework right now.
Okay, no you're not. You're talking to Jackie.
Yeah, I'm doing homework.
Alright, guys. Alright, sweetie. Yes, that was my daughter. Alright, strong risk factors include they have genetic mutation. Isn't that what I just said? That predispose to hereditary breast and ovarian cancer syndrome. For example, BRCA, which we call BRCA1 and BRCA2. Inherited risk can be passed through either the father or the mother's side of the family. having a close family member who has had ovarian cancer, breast cancer, uterine cancer, or colon or rectum cancer. These all coincide together. Being older than age 55, being Caucasian, being of the ethnic group of Ashkenazi Jew, having had breast cancer, never having children or having children at an older age, 35 years or older, infertility. Weaker risk factors are having a menstrual periods beginning before age 12. I had mine at 11. It's alright, honey. It's just stressful. The beginning of menopause or the change late after, which means after age 50. And obesity. Yes, it is. Having a risk factor does not mean that all women will get ovarian cancer. Most women who have risk factors do not get ovarian cancer, and many women who get ovarian cancer do not have risk factors. There are some factors that may lower a woman's chance of getting ovarian cancer, such as using birth control pills, which I did, having a tubal ligation, which I did, which is getting your tubes tied, having both ovaries removed, which I did, or having a hysterectomy that includes the removal of the ovaries, which is what I did, having give birth and breastfeeding, which I did. Women, so I did all the right things, but I still got it. Women should talk to their doctor if they're concerned that they may be at risk for ovarian cancer. The doctor may recommend certain tests on a periodic basis, such as the transvaginal ultrasound and a CA-125 blood test, especially if you are a woman at high risk. Women Women concerned about a personal or family history of cancer and who are wondering about whether to have genetic testing can call this is for New York State. Never mind. Cancer, woman's doctor can also be, you know what? I'll give this number. They can call the New York State Cancer Services Program Connection at 1-866-442-2262. That way, if you have any questions and you live in another state, unfortunately not another country, but okay, sorry. But if you live in the States and you can't find information, definitely call 1-866-442-2262 to get any information that you may want. Diagnosis and treatment. Ovarian cancer is diagnosed in about 22,000 women in the U.S. each year. Often women have cancer with ovarian cancer have symptoms for many months before the correct diagnosis is made. It is not uncommon for women to ignore symptoms such as nausea, diarrhea, constipation, pelvic pain, bloating, not being able to eat, feeling full. While these symptoms may be due to other causes, these can be symptoms of ovarian cancer. Any woman with symptoms like these that do not go away after several weeks should talk to a doctor and ask whether her symptoms might be due to ovarian cancer, which I do. I did all this. If a woman with these symptoms sees a doctor, he or she may ask her, the doctor may ask her to go through some tests to find out what the symptoms may be due to. These tests include a physical exam. This is done to check general signs of health. A doctor may press on the abdomen to check for tumors, or abnormal buildup of fluid. Pelvic exam. This is done to feel the ovaries and nearby organs for lumps and other changes in their shape and size. An ultrasound. This is done to using sound waves to make pictures of the inside of the body. Blood tests. Blood tests may be done to check the level of several substances including CA-125. A CT scan or MRI. These imaging tests show details about the inside of the body. A chest x-ray. This is done to find out if cancer has spread to the lungs. Mine did. Most likely. They're not quite sure, but they don't want to do a biopsy yet. Finding the disease early makes cure and remission more likely. Cure means that the cancer has gone away forever. Remission means that there's no evidence of cancer, meaning you can't find it, but it is too early to know if it has been cured or if it will come back. Most women who are suspected of having ovarian cancer will have surgery to confirm and treat the disease. The surgery is called a laparotomy. Laparotomy. It's a hard word and it's long. This surgery involves making it, I'm going to lap drop. Anyway, incision or cut in the abdominal cavity. This allows doctors to see the tumor, ovary, and abdominal area. Oh, I'm sorry, darling. The surgery, abdominal cavity. This also allows doctors to see the tumor, ovary, abdominal area. There we go. During surgery, the doctor may remove as much of the tumor as possible, or they may take a biopsy, smaller sample of the tissue. After surgery, the doctors will tell the patient about all the treatment choices. Because every woman is different, doctors can help patients figure out what the treatment option is. Each treatment comes with different outcomes and side effects. It is important for women to get this information, as much information as possible, and understand what happens with each treatment. Most women will get drug therapy called chemotherapy. Chemotherapy for ovarian cancer is usually made up of different medicines. I'll skip the rest of that. For women who are diagnosed with ovarian cancer, in addition to medical and surgical treatment, women often feel better by doing other things. Women should talk to a doctor before starting anything new. Other activities or suggestions may be very helpful. Then you got proper nutrition. Eating well is important to build up the immune system. Good nutrition also guards against other infections that can make you sick. Nutritionists say that women undergoing chemotherapy should try eating foods high in protein like eggs, cheese, kidney beans, and peanut butter. Peanut butter was one of my go-tos during chemotherapy because holy nauseousness. Chemotherapy can change the way food tastes. It is helpful to remember that if something tastes bad one week, it may taste better another time. Hey, Jimin! It's okay. I'm just reading this because women need to know, and there are some women that might want to know this stuff. So I'm just reading it from the book. I only got like a couple more pages to go, and then that's it. I'm going to put a timestamp somehow in when I re-edit the video-ish type thing, and put the timestamp of when I started it, which was at 11 minutes, and when I ended it. There we go. we are down to exercise. Oh, wait. Chemotherapy changes for taste, and 1 week will taste better another time. It might be helpful to eat small amounts of food more often during the day. Snacking on vegetables or fruits is also a good idea. One thing we found that helped me was drinking the Ensure. Exercise, even though it may be difficult during chemotherapy or after surgery, but even a simple activity like climbing the stairs or taking a short walk is helpful. It is important to keep your muscles, skin, and circulatory system moving. Stay positive. Have a positive attitude. Having a positive attitude is important during or after treatment. Women should set goals for themselves, but it is important that these goals be realistic and that the patient understand they may be limited in strength and activity. They may not have the energy to do everything they would like to do. Ain't that the truth? Relax. It may seem hard to do at first, but there are many ways to ease muscle and emotional stress. Women can feel better by doing breathing exercises, yoga, physical rest, swimming, and or other peaceful activities like gardening and painting or reading. I just broke this. Oh well. What don't they believe you on? Alright, honey. I'll do a more positive live later. I'm trying. Find a support group, which I am going to be looking for after this live, by the way. Bye, sweetie. I'll talk to you later. She will. There are support groups for women with cancer that meet in person or on the internet. Support groups are often run through a doctor's office or hospital. These are helpful places to share the thoughts and feelings that others may have a hard time understanding or coping with. There are also support groups for caregivers too. Doctors or hospitals can give information on how to find support groups. For more information on local support groups, this is for the New York Health, okay. Education. Learn about ovarian cancer so you can be your own advocate. It is important to take an active role in making decisions about your care. Be sure that you understand the disease and the treatment options. You may also need to ask for more information when you do not understand something, but be aware that everyone is different and not everything you read will apply to you. Oh, I'm sorry. Education about ovarian cancer may help women and doctors find the disease early. There are some important things that everyone should remember about ovarian cancer. Ovarian cancer is the 5th most common cancer in women. Ovarian cancer affects women of all ages. Pap smears do not test for ovarian cancer. And talking about ovarian cancer is important. Important. I have stage 3. They're not sure if I have stage 3B or stage 3C. And I'll tell you the difference. There is a difference. I forgot what color it was in. Here it is. Alright. So if it's stage 3B, it's 3/4 inch or smaller, which is what I think I have. because my tumors aren't showing up on the CT scans. If they were 3/4 of an inch or larger, it would show up on a CT scan. So minus stage 3B. And have spread into the abdomen, but not the lymph nodes. So I'm hoping it didn't spread to the lymph nodes. Hopefully I'm not stage 3-4 or 3C. So, if a woman has a nagging sense that these symptoms represent something physically wrong, she should persist in seeking adequate evaluation from a physician until answers are found, or at least the risk of ovarian cancer is ruled out. Unfortunately, the combination of symptoms, ambiguity, and inadequate screening measures can contribute to late detection of ovarian cancer. Aw, it's alright, darling. At this time, the only definite means of making an ovarian cancer diagnosis is through a surgical procedure in which ovarian tissue is obtained and examined by a pathologist. Again, the only way to know for sure is having that laparotomy. I said it right this time. However, the combination of accurate history and physical examination, including pelvic exam, can heighten the suspicion of ovarian cancer. Routine workup for ovarian cancer may also include blood tests such as cancer antigen 125, which is CA 125 level, the CBC, which is complete blood count, and chemistry profile. So, my cancer, unfortunately, is, it's in the beginning here. 90% of women's cancer, no. Had it. Where'd it go? Oh, page 10. Yeah, I got it. Alright. So, 90% of ovarian tumors are epithelial. And is the leading cause of death from gynecologic cancers in the United States. Epithelial tumors, those that start in the cells covering the lining of the ovary, can be subtyped into serous, which is the most common, mucinous, endometrioid, clear cell, and Brenner tumors. The remaining categories are germ cell tumors, 5% of all cases, and sex cord stromal tumors, which are also 5%. So my cancer is in that 10%. They don't know if it's germ cell or if it's sex cord. They're not sure which one it is. So it is important to emphasize that although all cancers arise from genetic dysfunction, only 5 to 10% are actually inherited. All right. So that's it. That's all I wanted to talk about. So 55. So It took me 45 minutes to read that stuff. Yes, go to bed, darling. Alright, get some sleep, and you know what? You can talk tomorrow night. Because you don't have school on Saturday, do you? Countries, you know, different countries are different, so. But anyway, for those of you that stuck it out and listened to me ramble about and read about ovarian cancer, I thank you very much. Obviously it is very, very dear, close and dear to my heart because I am a cancer patient. My type of ovarian cancer is terminal, meaning that it was found after my ovaries were taken out, 9 years after they were taken out. It's also a rare form of ovarian cancer. It's in that 10% of ovarian cancer that women get, and unfortunately it is very, very chemo resistant, which means bye Ruru, I love you too, darling. So that means that being chemo resistant means there's no chemotherapy that really there hasn't been any good signs of chemotherapy working. There's like 5% of treatment. Very few, that means very, 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 very few women with my type of cancer have actually seen progress from chemotherapy. However, like I stated and stressed, the only way to know is surgical. So I had chemotherapy. I had intense chemotherapy for 5 months, almost 6 months, because we had to skip a dose and restart and stuff like that. I went 3 weeks with just Taxol. So it was 1 chemo treatment on a Monday. It was 3 weeks of that. And then the 4th week was 2 chemotherapy treatments. So I had carboplatin as well. So it's called carbotaxol. Carbotaxol. It's very intense. It's what is given to breast cancer patients. It is known to kill it's known to kill cancer cells, but unfortunately my tumors don't react to it, but they thought maybe the cells would, it would kill the cells, but they don't know if it worked. Now with my case, because in my case, I've had blood work, I've had CT scans. Way before I found out that I had cancer, I had gynecological exams. I had ovary. I've had intravaginal ultrasounds. I've had pelvic exams way before they found my cancer. And all of those came out normal. All of my blood work throughout the years came back normal. I went in because I was having severe abdominal pain. I went in on June 8th, and they found that I had diverticulitis. So with that, they admitted me to the hospital, and he felt that I should have surgery, and I was like, no, I'm not comfortable with the surgery. But if anyone has watched my cancer story, you know that my cat found the cancer before anything, and he was still reacting the way he did to my side and my upper left chest. And I'm like, all right, you know what? I'm gonna, animal intuition, I'm gonna have the surgery. So I called them and let them know, okay, let's do this. So he did it August 13th, and August 26th I found out that I had ovarian cancer. The tumors are microscopic, that meaning they are very, very, very small. They're not going to show up on any tests, and not even the blood tests, because my blood tests that whole summer, because I had diverticulitis attack, all the blood tests came back normal. So there was no concern about ovarian cancer at all. None. So my one oncologist up here said that I don't need chemotherapy. But anybody that knows anything about ovarian cancer knows that it is a very deadly cancer. And I'm like, I'm not okay with that. I'm not okay with that. I want a second opinion. So I actually went down to New York City. And I had two nation-renowned oncologists, and they both stated that yes, I need to have chemotherapy, because even though the tumors are not going to be affected by it, the cells may be, like I said earlier. The only problem is that all my tests are still coming back. Nothing's wrong. There's nothing showing on it. But in the meantime, we don't know if the chemotherapy worked on any of it, whether or not the tumors happen to be affected by it or the cells. But this is so hard. Unless they do surgery, and unfortunately it's hard to do surgery sometimes because there's chances that the cancer can spread faster, or you just can't find anything. So like I said, my cancer is rare. It is in the 10% that can't be treated by chemotherapy treatment. And my cancer, the good thing I have going for me is that my tumors are very, very slow growing. That's the good thing that I have going for me. Except right now, the doctors are I'm guaranteeing you that the doctors are thinking that all of my symptoms are in my head. And thinking, well, because she has ovarian cancer, she's going to think every symptom she has is her ovarian cancer spreading. I've done research on top of research on top of research on my ovarian cancer. And with my ovarian cancer, the survival rate is very slim. Usually with chemotherapy, ovarian cancer can reoccur within the first 2 years. And if it doesn't, it will reoccur within 5 years. Most women's survival rate with this type of ovarian cancer is 5 to 10 years. So it's very stressful. I'm in the 3rd year of this since my diagnosis. We don't know how long I had it prior. So September is Ovarian Cancer Awareness Month. So this is part of the reason why I wanted to go over this with people. It's very important. It's not just important for women to know, it's very important for men to know. That way you can help your spouse, your daughter, your sister, your niece, your friend, your mom. Be like, you know, you're having these symptoms. I think you need to be checked. And if my video, if somebody watches this whole video, my goal is to, even if it helps one person, you know, be like, oh my gosh, I'm having these symptoms. I don't want to think that it's ovarian cancer, but these symptoms have been going on and on and on. And the doctors have done tests and it shows that I'm fine. But we never thought that it could be ovarian cancer. I'll go to the doctor, you know, and just to make sure. So, you know, if I help one woman, I've done my job. So, thank you for watching. I know this video was long, but I hope it was informative for you, and I pray for everybody who is going through anything like I am going through, or has a family member that is going through cancer, or it's hard. It's not only hard on the patient, it's hard on the caretakers, the family, loved ones. It's very hard. We just found out that my baby brother has brain cancer, so my parents not only have one child with cancer, they have two. You know, and it's hard. It's hard. And we go next week to see if my daughter has any oral cancer. So, you know, it's stressful. It's stressful. Anyway, thank you for watching. I love every one of you. If you found this video likable or informative, please give a like below. If you're not subscribed, please subscribe and hit the bell button. I usually do lives. I don't usually do videos, but sometimes I do. But I usually do lives either on the daily or at least once a week. A minimum of once a week. So, unless I'm really, really sick, and then I might skip. Which, I've had people concerned. They're like, oh, you're back. Where have you been? That type of thing. So anyway, thank you, and I will talk to you later. Anybody that is caught in the path of the hurricane, please be safe, and we are thinking of you. Peace. Love you. Bye.